brought to you by Dallas Renal Group. Dallas Renal Group provides comprehensive kidney care, including transplant and home dialysis services. Information can be found on dallasrenalgroup.com or on the Dallas Renal Group Facebook page. It's also sponsored by Comfort Care and Hospice, who provide end-of-life and hospice-related services throughout the entire DFW Metroplex. My name is Dr. Vik Prakash, and I'll be co-hosting today's show with Dr. Paul Cespedes. We've got several great shows scheduled in the upcoming weeks. Details can be found on our website, doctalklive.com. That's DOCTALKlive.com. And while you're at it, head on to our new YouTube channel, Doc Talk Live, and comment, like, subscribe to see more of us speaking on topics that you'd love to hear about. Also, if you're a healthcare professional and you'd like to be on our show, send us a request through our website, Doc Talk Live, or through the Doc Talk Live Facebook page.
All right, good evening, everybody. This is Dr. Cespedes, your co-host of Doc Talk Live. Today, we have a great show for all of you. Now, at one time or another, we're all prone to encounter minor injuries to various body parts, such as our fingers, hands, arms, wrists, which, as we know, can cause a lot of pain and swelling. Most of the time, our body movements do not necessarily cause problems, but it's not surprising that symptoms may develop over time from everyday wear and tear, overuse, or an injury. That's why today we'll be discussing orthopedics, and today we have Dr. Graham Milam with us in the studio. To be part of the conversation, please call us at 972-235-5555. Again, the number to the show is 972-235-5555. We'll be happy to take your questions live throughout the show. Dr. Milam, welcome to Doc Talk Live. Thank you very much for volunteering your time to be part of the show. Tell us a little bit about yourself.
Well, thanks for having me. I should probably say my name is Milam, last pronounced.
So
that's fine. It's a common thing that comes up daily. But I am new to the Dallas area. I'm an orthopedic hand surgeon, practice with Lankford Hand Surgery Association. Our office is in Deep Ellum area, and basically offer all services for upper extremity issues.
Fantastic. Let's get into the show. Dr. Milam, thanks again for being here. Our first question, well, let's start off with some statistics. The CDC reports that musculoskeletal disorders are among the most frequently reported causes for lost or restricted work time. The Bureau of Labor Statistics in 2013 showed that it accounted for 33% of all worker injury and illness cases. In 2015, sprains or strains resulting from overexertion and lifting accounted for 31% of the total cases. So, total 80% occurred to private industry workers, and carpal tunnel syndrome may affect as many as 1.9 million people. 300 to 500,000 surgeries are performed each year to correct the condition for the matter. So, can you explain to us why a person would come see an orthopedic hand surgeon and what types of diseases you typically treat?
Yeah, that's a great question. So basically, we treat any type of issues that affect the entire upper extremity, really from fingertips all the way up to and including the shoulder. And basically anything that is bothering people, that's what we treat. That's what we see on a day-to-day basis, and things that cause pain or deformity, stiffness, swelling, anything that's unusual or bothersome to people, that's what we do. And the gamut is pretty wide there, and we there's nothing really that we don't see. And if it's not something surgical, there are tons of things that we get into treatment wise that can help avoid surgery, and surgery is kind of our last resort.
So with that being said, can you maybe go over some of the basic anatomy of the hand, and when you physically examine a hand, what are you looking for?
So the anatomy, we kind of call it the high rent district. It's very packed in. That area is kind of like the neck or other areas of the body where there are a lot of structures in a very, very small area. So that's a huge part of what we do, basically trying to figure out what's going on. And really the key components when you look at a hand specifically, and really this goes for wrist and forearm and elbow, arm and shoulder as well, is just looking at what you see on the outside. Is there any deformity? Seeing what the motion is like in each joint, and so on and so forth down the line. You evaluate the nerves, the tendons, all the different components, and that kind of helps us to formulate what our next step is going to be.
Let's take a live call. Hey, welcome to Doc Talk. What's your question for our expert today? Thank you for your call, Dr. Mill.
Yeah, so that's a great question. Tennis elbow or lateral epicondylitis is an extremely common problem affecting the outside, the lateral side of the elbow. It doesn't just happen to tennis players, it really happens to everyone, or a huge percentage of people at some point or another in life. And it sounds like from what you've been told is good advice. It basically tends to get better in the vast majority of people. But frustratingly, I think for a lot of people, it takes a really, really long time to get better. So we kind of think that usually by 18 months or 2 years, the process should run its course. And that is kind of the hardest thing to live with, and kind of to basically put up with, tolerate that natural history of the disease. And there are tons of things that can be done for that problem in terms of treatment, both invasive, non-invasive, the whole spectrum. There are a lot of upper extremity surgeons that recommend surgery for that at different points in the process. But it seems to respond well if you can stand waiting to just conservative, kind of the old tincture of time thing, and it'll run its course.
We got another call? Oh. Dr. Mill, what are the common causes of hand pain?
So the most common things that we see in clinic are really related to tendon problems and nerve problems on the non-trauma side. A huge part of hand surgery and upper extremity surgery is related to trauma, and so that's kind of in its separate category. And with those things, we fix the things that are broken or cut or injured, and that's a little bit more straightforward in terms of the diagnosing and the whole process. But the things that we see commonly are nerve compression issues in the hand and forearm and elbow, and then also just a whole various and sundry list of tendinitis type problems. We also see a lot of arthritis, joint degeneration problems. There's many small joints in the hand and wrist, and these can all be problematic, and those are the things that we sort through in our clinic visits.
Can you give us a little bit more details about arthritis? What kind of symptoms do people experience, and what are the more common types of arthritis?
Yeah, so just to answer your second question first, the most common type of arthritis is osteoarthritis, which is just kind of surprisingly we don't understand the process as well as people think that we understand it. But it's a degenerative type of arthritis that tends to be slowly progressive. Interestingly, we see a lot of arthritis in the base of the thumb. It's called the carpometacarpal joint, and we see a lot of patients that have arthritis there on x-ray that maybe we're doing the x-ray for some other problem and they don't even have any symptoms there. So not all arthritis is a problem. If it's not bothering people, we don't really worry about it too much. But that arthritis at the base of the thumb is one of the most common ones we see, but also all the small joints of the hand. Arthritis of the wrist we see routinely in the elbow as well. So,
okay, let's take a live call. Hi, thanks for calling Doc Talk. Go ahead with your question. All right, thank you.
Yeah, that's a great question. That comes up a lot. Very common question. The quick and easy answer is that we really don't know. We don't think that those things have a big impact, but we don't know. So anytime people ask me that question, I just try to be honest and tell them that it's not something that we have the answer to definitively. It doesn't seem like diet or dietary modifications make a big impact on the development of arthritis or the symptoms of arthritis, but that's another one of those things that I I don't think anyone would say has been definitively answered in the field of orthopedics or field of upper extremity surgery.
Out of curiosity, with the advent of the technological age these days, everyone has a computer, a laptop, a handheld. Are you seeing more hand or arthritis issues because of that?
That's a really interesting question. There have been things that come up from time to time, and a few years ago when BlackBerries were first coming out and kind of all the craze, there was a thing described in our literature called BlackBerry thumb, and I don't know if I was in the minority or what, but I never really understood what that entity was or what it was referring to or how best to treat it. But it seems like the short answer is not really, but people routinely do complain of their symptoms of underlying disease being exacerbated, made worse by use of these devices that we use. One common example would be cubital tunnel, which is compression of the ulnar nerve at the elbow being made worse by holding a phone up to the ear for prolonged periods of time. Just that elbow flexion position can cause excess pressure on the nerve and make those symptoms worse. So that would be just a common one that comes up routinely.
Okay. All right. So say somebody comes into your office and says, hey, my hand hurts, my elbow hurts. How do you go about assessing that and determining what the underlying issue is?
So so much of it is just kind of our classic medical training, history, physical examination, talking to patients, understanding, do thorough physical exam, and then going through our different workups. So x-rays, and there are many other steps after that we kind of delve into to sort it all out. So it's a process.
Hey, let's take another live call. Welcome to Doc Talk. What's your question? All right, thank you for your question. We're actually discussing hand surgery today with Dr. Milam. So for a general orthopedic question like that, go ahead and submit it on our website and we'll try to get back to you. Now, folks, we're about to head into our break. So if you're just tuning in, you're listening to Doc Talk Live, and we're discussing hand surgery with our expert, Dr. Milam, today, who's an orthopedic surgeon. And looks like we got one more call. Let's see if we can squeeze one in before the break. Hi, welcome to Doc Talk. What's your question? Sir, we're about to go into a break. I'm going to pick up your call while we're on during the break so you can keep talking, okay?